Hi, my name is Lauren Arias. I'm a physical therapist. I've been treating patients for the last 3 years at a balance center, and I flew all the way from Miami to Colorado to see Dr. Hesch. I've been dealing with chronic pain for about 10 years, and I took actually one of his courses online. I found him through just online on the internet, found his course, was fascinated by it, and thought it would be a way for me to start treating my patients and also for me to get treatment. I've tried years of conservative therapy on myself and by other very well-esteemed clinicians and coworkers of mine, and I just felt I needed something different. So I've been dealing with, for about 10 years, I'd say, low back pain, intermittent low back pain. Also, hip pain would come and go. And then the most debilitating was bilateral ankle pain that I've been having for about a year now, which really affected the way I was working. Standing on my feet all day, I just wasn't able to, so I actually had to take some time off. And then I'm also dealing with facial neuralgia. Now, that was something that Dr. Hesch, he has a consultation with you right before you send in your information to him, and he calls you up, he gives you a consult. And it was something he said, we'll take a look, but I can't make any promises. And I was like, fine, but I have plenty of other things to work with. So right now, this is the last day. I just finished my last treatment. It's 3 days, and he's worked all the way from feet to head. His approach is whole body. So I can say yesterday was the first day that I was able to walk without pain. Very, very minimal pain, if anything. I had to sit down for a minute or two in my feet, and I was able to walk for about 10 hours, which is a little excessive, but I'm in beautiful Colorado, and I was able to see all the sights, and I took advantage of it, and it was incredible the way he was able to really isolate what the problem was in my feet, which MRI or imaging or x-rays just couldn't diagnose. So he started at my feet, then he worked into my hip. We found I had some bilateral anterior ilium, so just means rotated pelvis bilaterally. That was causing a lot of hip and low back tension. He helped and has shown me how to self-correct that. And within the first treatment, he corrected that. And then we worked our way up. We found I had quite a bit of restrictions in my shoulder joints that was really affecting the way I was able to hold my head. So he's helped work on all that. And then the most important for me was my facial neuralgia. Now, what he worked on specifically was just joint tension and just seeing how my jaw, my upper cervical was moving and not moving. And we found a lot of restrictions of motion in that area that he was just able to isolate and just help move and open up that area. So the first day I felt relief a few hours. About 30 minutes after his treatment, I felt decreased sensations and pins and needles in my face for about an hour to 2 hours. The second day that he treated me, which was yesterday, about 30 minutes after leaving here, I didn't have any pain until this morning after eating, so after using my jaw a lot. And then right now I feel pretty good. So I'm very encouraged, very hopeful. He's taken his time. He's shown me tons of exercise that I can do, because now that I feel everything is moving and every joint is moving properly, now I can really strengthen. I just felt every time I would strengthen and I would try a new exercise program, I would just injure myself. And being a physical therapist, I was like, what is going on? Now I know what's going on, and now that it's been addressed, I can really focus on which I feel is my specialty, which is really just exercising. And I had a professor that said motion is lotion, and I've really geared my practice towards that, is that just moving. But now I feel, because of his method, I can move better now, and I'm just hopeful that I can now start a road of recovery, and I can now strengthen. So if you're thinking about it, I think it's definitely worth a consult, at least a phone call, and I'll be taking his other courses.
And so you had tried exercise. You're a PT, and you had seen other physical therapists. So
absolutely.
Movement didn't restore
the
lack of micromotion in the jaw and in the occipito-atlantal joint and in the atlantoaxial joint as well.
It's also something that, at least as, I'm a third year in DPT, and it's not something that they teach you at school. They teach you really general things, and then as you become a clinician and you get more practice, then you start specializing. So it's not something that I feel that many clinicians right off the bat, if they're not even interested, will know how to find those subtle movement patterns in the neck. They'll be focused more on, more things that we see. I don't think this is typical. I've only actually ever had one patient in 3 years that has presented with some type of numbness and tingling. So it's not something that we see on a daily basis. So just felt that your approach is different just because it just focuses on how's the joint moving. And you checked my whole body. How was every joint moving? And that's where I'm going to start practicing now and making sure, okay, work your way up, see what's restricted, and if that area is restricted, okay, let's start coaxing it. Let's start getting it to move. And that's what it's a whole body approach. It's pretty cool.
Very good.
Yeah.
And we did delve into some work on the facial bones and
Yes.
the cranium.
Yes.
I don't buy into this craniosacral model. It just doesn't make any sense whatsoever. It's a theory. It's not, there's no studies that have validated that. But I did test kind of springiness, play
Yeah.
in different directions, and found directions of restrictions. And what did it feel like, for example, working on the temple bone? What did that feel like?
So I have a lot of restrictions I had right here. So before I came just 3 days ago, the pain I felt was in these two areas. It would shoot straight into my eye and straight shoot into my jaw. Now after the first day, it just settled right in here. So the second day of treatment, you really focused on seeing how everything kind of moved in this area. Sutures, my frontal bone, how did my jaw move? Was it able to move up, down, side gliding, all sorts of directions. And then you were able to see, okay, and I felt them also, okay, that doesn't move and that hurts. So working in that area, just opening up, my favorite was this one. Just pulling down, and then that other one where just shifting up. And it just felt, decompression is the only way that I can explain it. And then as decompression occurred, it just started centralizing. It's just like when we talk about when there's nerve injury and people get that nerve pain down the legs, let's say, and maybe you've had therapy and your therapist will say, oh, we want it to centralize. So we want the pain to go towards the source of the problem, stop shooting out signals and pain signals down into the area where there's really no injury. So that's what I felt like. I felt like it was concentrating right here. That C1 occiput area, where you found that there was that rotation. So I'm definitely going to try those exercises, just continuing opening that up. Because for hours on end, I didn't have any pain. That I told my husband, I was like, I have to go searching for the pain. Like, is it even there? And it's something that you said you didn't promise. I think you're surprised too that we were able
absolutely.
to.
No, indeed. The facial numbness, I had no expectation that I was going to be able to influence that. But when it happens, I'll take it. I may not know why. I could dig deep in my neuroanatomy textbooks, but not even sure I'll be able to make the connection.
I think it's just, we address the whole body. And,
So, do you think you'll need to come back and see me again and have me put my hands on you?
I don't think so.
I don't think so either.
No.
I don't think so either.
Because every time we've tested, things have stayed the same.
Yeah.
And with the exercises, I think like once you get the joint, you get those muscles, they work as they should, and they'll stabilize that joint.
Yeah. And when I worked on your ankle, I did like 30 oscillations. So that's a large number of oscillations. But then when I did work like on the jaw, how long did I apply a very, very subtle force?
Prolonged. So it was 2 to 3 minutes.
2 to 3 minutes,
3
absolutely.
minutes.
Yeah. And something, magical can happen sometimes when you do a very slight force because the body's not intimidated. The body relaxes, the body cooperates. And it seems like it may reboot the computer to where it's fine thereafter. The movement is restored. It's not like keep coming back for
Yeah.
repeat adjustments or such.
So I feel that's empowering. And that's something I've always told my patients. I haven't done my job if you need to come back in 6 weeks.
True. Yeah. And so do you feel empowered? Like you know what to do
Yes.
for the job
Yes.
and what to do for the upper cervical joints,
Yeah.
etc.?
And I felt kind of just a little overwhelmed. You know, as a PT, I analyze everything. And sometimes I feel like it's always good to have somebody else take a look at you. Somebody else see the things, tell you where it is, and then you put your knowledge in together, and you know.
But you've had to wear boots for a while with a high heel, you know, and your ankles were stuck in a position of plantar flexion, and now you have easy 10 degrees or more of dorsiflexion.
Yeah.
So how does it feel now to walk without being in your boots?
I was able to stand, so this morning I took, shower, got ready. I was up for about an hour without any discomfort. I actually, well, I won't say this, but it's very nice to be able to just stand barefoot. It's very
nice. And that should stay down. Every time you walk, now that joint is going to naturally go into full motion. So if you did nothing specific to it, it's still going to be reinforced every time you walk. So it's not like you have to.
I just felt like I kept stretching my calves, stretching my
right.
soleus, and just nothing would happen.
Exactly.
It just wouldn't move.
Right.
And now it's moving. I actually got a really good stretch in my soleus this morning.
Okay, wonderful.
Because I did that 10-hour walk yesterday. I'm like, I definitely need it.
Yeah, you walked a lot yesterday.
Yes, it felt great. It just felt great. So I'm just so thankful. I feel so blessed, and
Well, thank you for sharing your thoughts. I appreciate it.
Good.